many of you have asked what it's like to have sutures taken out and if it's a big deal or not, and it's really not. It's not a big deal at all. I've been doing this for 17 years, and of course I was paranoid in the beginning, but now it's not a problem, it's not a big deal. So basically, turn your head, man, right there. So basically what I do is I go in and I locate where the sutures are. And they're blue threads, little blue 3L Vicryl sutures. And I locate the knot, and I go underneath with the scissors and I cut like that. So I make a little cut. And then I hop around here and go like every third suture and cut, just like that. It's very simple. Tip your head back. And so what I'm doing here is I'm just following the line, and the sutures are placed in such a fashion to where it's called a continuous baseball stitch. And we just going in underneath, cutting. Now the patient has taken really good care of his donor area, and so it's very easy for me to see these sutures. Sometimes people do not take care of the donor area, and you cannot even see the sutures. Okay, so we're almost done. Cut right there, and then you can turn your head this way. We're gonna go to the end, to the other side, and make another cut on the knot. And a lot of times you have to get in underneath with a little hook right here and cut it. And there we go. Part of suture removal is basically going in and grabbing the suture at the end where the knot is, like that, and then pulling gently to see if it's still, see how it's coming out? Mm-hmm. It's coming out like that. That's the suture. That's the knot of the suture right there. Okay, and then once you cut the ends, everything loosens up, and it's very easy to extract the sutures from there. So I'm going in here, pulling out sutures here. Just like that. See? Sutures just pop out. Okay. Okay, now this is just demonstrating how the sutures pull out. See? You pull out just like that when you make the cuts. See how easy that is? Long suture right there. There. And that's how it's done. So when you get home, I want you to basically wash your hair very aggressively in the back with your fingertips, and really foam it up and get all the scabby material off the back of your head. Okay, and then use bacitracin for the next couple days, and triple antibiotic cream. Okay. So the last part of suture removal is just rubbing your fingers along the suture line and then making sure that there's nothing left, that you didn't leave any sutures in the head. And of course there's some scabby material falling off. That's perfectly normal. But yeah, it feels great. There's nothing in there. Patient's fine to go home, and the rest of it is just one big waiting game for the next year. And that's what it looks like. Suture removal. FUT.